Welcome back, Dr. Azahali. We're going to continue our series of talking about type 2 diabetes. Remember we talked last time about insulin resistance, the genetics, what does it mean to be diabetic, type 2 specifically. And we're going to start talking today about management of type 2 diabetes in terms of medication. We'll have a whole session on diet exercise in the futures, but I want to clarify a few things about medication, mechanism of action, how do they work, what medicine is right for me? A lot of my patients ask, okay, well, this is better than the other. There's no better medicine than the other. It is just there's medicine that fits a certain person more than the other. Type 2 diabetes is a complex disease. I'm going to show you here on the slide. It is not only disease of the pancreas, it's a problem in the liver, in the kidney, in the heart, in the muscles, in the bone, in the fat tissue, and so on and so on. So in order to tackle type 2 diabetes medication, we have to understand how they work, where they work, what do I expect from them, what are the side effects. So as we see in this slide, we have medication that work on the liver by decreasing glucose production. We have medication that work on the fat tissue by decreasing the free fatty acid release into the blood that will affect insulin resistance. We have drugs that work on the muscles to increase glucose uptake by the muscles to be utilized as energy. We have medication that work on decreasing absorption of sugar from the GI tract and affecting fat absorption. We have drugs that work on the pancreas that improve insulin secretion and decrease glucagon secretion. So just remember, we talked about what happened to the beta cells, and we talked about the effect of insulin resistance. So if I want the best medicine for type 2 diabetes, then I want medicine that first control my sugar very well, bring the sugar down, fasting postprandially. I want to bring the A1C down. I want also to preserve my beta cell. We have limited beta cells, limited insulin storage. I want a medicine that helps me preserve that. Also, a medicine does not cause hypoglycemia, does not cause weight gain, does not worsen heart disease, hopefully protect me from heart disease, does not worsen renal failure, but improvement, get my kidneys better. At the same time, protect me from cancer, and also help prevent hypoglycemia and hypokalemia that can come with diabetes medication. So it's very difficult to pick the right medication. And hopefully we'll start with one after the other to show how do they work on the body, what are the expectations from these medications, how can we use them. First one that ever came out was a sulfonylurea drug. Sulfonylurea, probably all of you are familiar with it. These are glipizide, glipizide, glinclamide, glipizide. There's probably 10, 15 of different drugs in that group. They all call them the sulfonylurea because they work on the sulfonylurea receptor in the pancreas by improving insulin secretion, and that will control glucose production. I'm going to show in a slide what are the benefits of that and what are the risks. Here we see how sulfonylurea work. They are attached to ATP-sensitive potassium channel attached next to it that will activate potassium influx into the cells, bring calcium eventually into the cells, and that will depolarize. It will bring these vesicles or granules that carries insulin. This is our storage of insulin inside the beta cell. It will be carried to the surface of the cell and be released. What that means, when I take sulfonylurea, I'm asking my beta cell to release their storage of insulin into the blood. This is good in a way that insulin will help me control my sugar. The problem with that process here, first, I'm killing my preserved beta cell of insulin. I'm increasing insulin secretion in a type 2 diabetic that already have too much insulin. This can lead to low sugar. The effect on the potassium can cause transient hypokalemia. We have all the data on sulfonylurea by increasing the insulin secretion affecting potassium, causing hypoglycemia, low sugar. It can worsen heart disease. It's also have effect on the weight gain, serious hypoglycemia, especially in patients who have renal failure or liver failure. So it does few things right, but does so many other things wrong, and that affect how we select these medications for certain patients. The second medicine we'll talk about is popular medicine. Probably everybody knows that there's probably 25% of the whole population of the world takes it. It's called Metformin Glucophage. We really don't understand how it works. Everybody uses it, but we don't know how it works. We have some idea. It may have an impact on gluconeogenesis of the liver, mainly work on the liver to decrease glucose production. We tell you sometimes take it at night so your morning sugars are better. It does a lot of things right, but some things are wrong. So the good things about metformin, it will lower glucose. It does not increase pressure on the beta cell, so it preserves my beta cell. Does not cause hypoglycemia, low sugar, unless I have a liver problem or kidney problem. It will prevent cancer by decreasing the insulin secretion and improving insulin resistance. Not only preserve beta cell, decrease low sugar, decrease the chance of hypokalemia, but also have a good impact on preventing cancer related to insulin resistance. Is good for the heart. We have every study in type 2 diabetes showing the arm they use in metformin, usually they have less heart disease than anybody else who on any other medication. We also know that metformin have prevention of complication of diabetes, nephropathy, retinopathy, neuropathy. Problem with metformin, not everybody can tolerate it. It can cause gastroenterology problem, GI problem, nausea, vomiting, diarrhea, bloating. That limits its use. We use extended releases. We start low dose and we build up as tolerated. We go from half a pill of 200 all the way to 2,000 milligram. There's no benefit beyond 2,000 milligram. If you can get to that dose with tolerance, then you can stay on that dose, don't increase it. If you can only take 500 milligram a day, there's no benefit of taking it because it's not that effective. So on this particular medicine, beside the GI side effects, it really does all the good thing for the body. There's another bad rep for it because people think it hurts the kidney. Metformin can increase lactate production in the body, so it can cause something called lactic acidosis only in people with severe renal failure and severe heart failure, but does not cause heart problem or renal problem. It's actually good for them, except you cannot use it in that scenario. So just looking at metformin here, you can say it works. You see here on the hepatocytes, so that means liver cells. So work on the liver by activating the AMP kinase. This will decrease hepatic glucose production in different ways. It helps with this lactate production, and that will make it put patient at risk of lactic acidosis. Decreased glucose production will make it ideal to decrease blood sugar in the morning. The other drugs we'll talk about are Thiazolidinediones, TZDs. Complex name, you don't have to remember that. Know the TZDs. The first one that came out was Resilin and Avandia and Actos. They were very exciting drugs. When initially they came, they work on all the bad issues that diabetes have. They work on the muscle by improving glucose uptake. They work on the liver by decreasing gluconeogenesis. They work on the adipose tissue by decreasing free fatty acid release and HERB, and they became a drugs great for insulin resistance. So in terms of TZDs, these drugs were great to lowering sugar. They preserve the beta cell. They don't cause hypokalemia or hypoglycemia. They supposedly were good for the heart. Unfortunately, when we know their PPAR gamma exists everywhere, we find out that they can affect the kidney and causing increased absorption of sodium and water. That caused edema. That did not help the kidneys. It worsened heart failure. The effect on the heart was inconsistent. Studies showed they were good, and studies showed they're not. They have effect on the bone, cause osteoporosis. There were reports of bladder cancer. So the effect on the body, including also effect on the fatty tissue by increasing fat cells and weight gain, limits their use and make them unpopular between diabetes drugs.